This video will demonstrate techniques for sampling breast lumpectomy specimens, breast margins, and breast sentinel lymph nodes. Be sure to always be familiar with the AJCC guidelines on the CAP website before sampling any specimen. As you can see here, based on the most recent AJCC guidelines from 2018, the staging is based on tumor size and extent of invasion, so we will pay especially close attention to these metrics. Here are the final sampling descriptions for the specimens you are about to watch. They are here for your reference, and we will show them again at the end. Make sure to weigh the specimen. Examine the surface of the specimen and note the laterality, right or left. Note the orientation of the specimen as designated by the surgeon. The surgeon may orient the specimen with stitches, clips, wires, as written in the electronic medical record. In this case, the anterior surface is marked with a stitch and clip, and the medial surface is designated by the localization wire. Be sure to measure in 3 dimensions from anterior to posterior, medial to lateral, and superior to inferior. Next, we ink the specimen by using 6 different colors of ink according to the standard inking procedure: medial surface red, lateral yellow, superior blue, inferior green, anterior orange, and posterior black. Be sure to use ample amounts of vinegar to make sure that the ink doesn't run. Inking can be a challenging experience at first, but you will become more comfortable with it through experience. An easy trick to remember the inking scheme is that blue is superior, just like the sky, and green is inferior, just like the grass. Serially section the specimen with cuts perpendicular to the long axis of the specimen and designate the sequence in the sampling description. In this case, the specimen was serially sectioned from lateral to medial into 10 slices. Examine the cut surface of each slice and document the findings. As you could see, in this case, there's a cystic lesion in the first slice. As you continue sectioning, describe any lesions identified, including the size in 3 dimensions and the closest distance of the lesion to each inked surface. Remember to use the electronic medical record and faxitron to determine the presence of any biopsy clips that may be present. If a biopsy clip is identified, document the shape and note in which slice the clip was found. Describe any lesions surrounding the biopsy clips. Some lesions will be ill-defined and difficult to give exact measurements. Remember to measure the distance of the lesion to the closest margins. In this case, the lesion was ill-defined with stellate borders and was present in all slices and abutting the lateral margin, superior margin, anterior margin, and posterior margin. Always correlate with radiology. This faxitron image confirms the presence of 1 biopsy clip. Therefore, we have found and accounted for all clips in the specimen. Begin submitting the specimen. Remember to perpendicularly submit each end. For specimens requiring fewer than 15 cassettes, submit the entire specimen sequentially. For larger specimens, submit 4 to 6 sequential sections around each clip or lesion. If the slice is too large for 1 cassette, you can bisect or trisect to make it fit into multiple cassettes. Remove the clip from the tissue before submitting. After submitting the entire specimen, we will proceed to submit the margins. For separate breast margins, describe and measure the specimen. In this case, the example margin is a segment of yellow tan fibrofatty tissue measuring 2.5 by 1.1 by 0.9 centimeters. Note the orientation as designated by the surgeon. In this case, the true margin was designated with a clip. Ink the true margin black and opposite side red. Serially section and entirely submit each margin. If the margin is large and requires greater than 5 cassettes, to reduce the number of cassettes and accurately evaluate the margin, the true margin can be shaped and submitted entirely. Several cross-sections of remaining tissue should also be submitted. The sampling procedure is the same for each individual margin. For breast sentinel lymph nodes, describe and measure the specimen. If the specimen is fragmented, give an aggregate measurement. In this case, the specimen consisted of fragments of fibroadipose tissue measuring 4.5 by 3.5 by 1.1 centimeters in aggregate. Dissect the specimen to find all potential lymph node candidates. Give a range of lymph node sizes. In this case, the lymph nodes range from 0.8 to 2.1 centimeters in greatest dimension. Submit all potential lymph nodes. Remember that some sentinel nodes may contain biopsy clips if they have been previously sampled. If a clip is present, be sure to document where the clip is. Small lymph nodes can be submitted entirely. Large lymph nodes should be sectioned with approximately 0.3 centimeter thick sections and entirely submitted. Ensure to submit the fibroadipose tissue because that may contain lymph nodes. Here is the sampling description for the specimens.